Ready? Places.
You're fun, Deb. You really are. You're fun.
Hello, everyone. Welcome to the Regional EMS Council of New York City. Today is June 20th. I am filling in for Dr. Lydia. Who's away. Yes, this is another traveler. Marie, do we have a quorum?
It appears to be a quorum, but I'm going to do a roll call vote. Charlie, you're rolling, correct? Okay, please respond when your name is called. Doug Jacob. Ari Weiss. Grace Cacciola.
Here.
John Nevins. Andrew Dahl. Allison Burke. William Goffin. Dominic Battinelli. Daniel Mizell.
Here.
Gary Gutzman. Robert Bristol.
Here.
Mordecai Goldfeder. Jonathan Matamoros. John Johnstone. Travis Kessel. James Downey.
Present.
Gerald Gelbar.
Present.
David Mikatansky. Joseph Schenker. David Benelli. Michael Raiola.
Present.
Michael Batch. Mordecai Lax.
Here.
Martina Baccarella.
Here.
Vincent Ferranco.
Present.
Nancy Benedetto.
Present.
Arthur Cooper.
Here.
Robert Krupe. Megan Ketzel. Manfred Fuchs. Sean Graves. Jerry Gumbo.
Good evening.
Aditya Langsam. Brian Levinsky.
Present.
Dennis Laurie.
Present.
Mitchell Powell. And we have a quorum.
Yeah.
Thank you, everybody, for coming in today. I know traffic was terrible, and I know some people like to travel at the beginning of summer, so thank you for making it. The last meeting was April 25th. We were not here for, well, we were here. I wasn't here for EMS week in May. So welcome back for beginning of summer. So the first item on the agenda is the approval of the April 25th meeting minutes. Did everyone get a chance to review it? Anything that anyone would like to add? Motion to approve?
Motion to approve.
Perfect. Second?
Okay.
Perfect. Approved. Marie, do you have the correspondence report?
Yes, I do. It's a long correspondence report, so I'm going to give you an abridged version, the whole one. Unless you want to hear the whole thing.
We'll read them. We have a long summer.
Yeah. Okay. From the Department of Health, New York State Department of Health, Drew Chesney, who's the new unit chief for education and certification, sent out an updated regional faculty roster. These people will be going for 3-hour orientation. Our own Scott Chang is on that list. Hallelujah. We finally got him on it. So now we can make him do more stuff. Ryan Greenberg sent out a solicitation requesting information for the performance standards. Part S has a new part in it, a new portion of law in it, that they're going to be using different types of measurements to gauge how your ambulance services are functioning. And they want to know any agency that already has performance standards written up and is willing to share them. We did send out the link to the survey, but I found that many people have not received it. I'll be sending it out again. I'd like to see New York City respond to this so that they know that that we respond to their request for information. So I'll send it out again tomorrow. Also, we forwarded to everyone from the state another survey. They want to know how they can improve vital signs conference. So if you have time, it's like 4 or 5 minutes, fill it out, let them know what you think. They ask about location and different places. They don't mention New York City because they can't afford to have it here. Yeah.
I wrote Staten Island in the other box.
It's the congestion pricing.
Yes, it is. Okay, and there were no enforcement actions for this last 2 months. But if you do want to see past enforcement actions, they're always on the state DOH site. And that's health.ny.gov/professional/EMS sanctions. Easy to find. Okay. We did receive ambulance operating certificates for New York City Police, Relief Fund, and New York City ESU. We get these every month as a state recertifies ambulance agencies. They send us copies of the operating certificates. For our core sponsors, Emergency Care Programs is offering free EMT training at multiple locations through the city. Candidate is only responsible for books, which is about $250, but the course is covered. So you could go to their website, which is emttrainingny.com. Okay.
Are these academy classes or?
I don't believe so. I believe they're full classes. Okay. Oh, we received core sponsor applications from FDNY, BNH, Emergency Medical Training, Staten Island EMT Training, Code 1, Emergency Care Programs, Emergency Aid Training, and RTI Training, and St. John's University. Every year, get the renewal applications. We have no real way to evaluate any training center in the city because the state does not give us pass-fail rates. Don't give us any information to gauge how a training center is functioning. But what I can tell you is that the applications were complete. So based on that, we can do it now, we can do it later in the meeting. We need a motion to recommend approval, just so I can get that letter up to the state.
Let's do it now. Let's get it
I'll
on.
make a motion to accept. I'll second.
You could vote.
Raise your hand.
Yes.
All right, let's raise our hands if we approve. Abstain. Approved.
And like I said, it's to me, it's a little silly. Because they've taken away all our ability to gauge anything that our training centers do. But this is our job right now. CME training. Critical role of EMS in stroke, which is being offered by New York Presbyterian. Actually, it's going to be held on June 26th at 7 p.m. And there's a registration that's glenoaks.org/CME. Is that the one that Dr. Krupi's going to be running? Yeah. I've heard a lot of good things about Dr. Krupi's CMEs, so
It's very awesome. Yes.
yeah.
Yeah, 450.
Are you using Aura? You got your own now?
Hi.
You had it, okay.
Since COVID, we've been running it same way.
As of the next one, it's gonna start running through our.
The element. Yeah, I asked Dr. Krupi if he wouldn't mind recording some of his CMEs, because it sounds wonderful. Also, NYC newsletter came out and announcing 23 EMS events, CMEs, courses, and conferences. They're a great newsletter, and it tells you all kinds of educational opportunities throughout the state and online. This past, unfortunately, North Shore University Hospital EMS Week lecture series in emergency medicine that was during EMS Week. Other roadside to bedside annual trauma symposium, Westchester Medical Center, July 13th. And there's a contact person that we should have sent. Everything that I read here, we have sent out. Okay. We received an email from Stephen Metz, the analyst to the Assembly Health Committee of New York State Assembly Programming Council, and they requested input from us with Bill 86683, and that's the extension of the community paramedicine program. NYSARA had sent in language, Onion had sent in language, and there were assembly side and state side bills, and we were able to give input into the final language of that bill. And it's really significant because we're at a point now where the Senate and the Assembly know that the New York City Regional Council is very much involved in looking at legislation and making recommendations. And the fact that they reached out to us makes me really hopeful for the future that we'll be having more communication with our legislators. And that bill did pass both the Senate and Assembly, and it's waiting, as Jerry said, in the governor's bucket, you know, to be pulled out and signed whenever. The same thing goes for the direct payments for ambulance providers. This way, if you take an ambulance, payment goes to the ambulance provider, not patient. And that also was passed and it's in the governor's bucket. The Center for Allied Health Education is looking at the EMA program director. I don't know if they found anyone yet, but we did post that also. There's a New York First Responders Summit that's going to be held July 27th in Washington, D.C. It's being held by Senator Kirsten Gillibrand. The conference is free, paying for the hotels is not, but they're not unreasonably priced, and it's something that we've gone. Scott and Jerry are going. I don't know if anyone else in this room is going to be going, but it's good to have people from New York City go to a summit like this that's going to have leaders, organizational leaders discussing EMS issues in New York State.
Is there an agenda?
Yeah, there is an agenda. I can send it out again.
I didn't see the agenda.
It's,
You have to actually sign up for it, and then you can see all the information. Not sign up, you have to go to the site, but I'll send the email site.
Yeah.
And New York State, well, NYSARA sent out a newsletter announcing 2 new DOH policy statements, and that's pilot educational programs and course funding, course sponsors, and EMS agencies. There was a small increase in reimbursement for different training and training courses for EMTs. I don't know if it extended to paramedics, but it was EMTs. So
No.
more money is better than no money. There was no.
just CFR and EMT.
Okay, and so we sent out agendas, minutes, and associated attachments for this meeting. We sent out our response to the Assembly. REMAC sent out advisories regarding the change in pain management, which is a paramedic level skill. And also just a reminder, the Office of the Regional Council is updating a slew of databases that we have. And one of them is specifically to ambulance services and volunteers. We want the name of your medical director and contact information so that we need to get information out to you about online medical control. And that's correspondence.
Thank you. All right, next item on the agenda is a staff report, emergency preparation update. Scott?
Okay, as Maria mentioned earlier, but now actually, it's part of the ongoing update. We asked agency point of contacts to please provide information requested on medical directors and all other agency related information in the email that was sent to the point of contacts. We continue to work with FEMA on the COVID related funds and for the period ending on July 1st, 2022. It is currently in final review. We are expecting the funds to be released shortly. Periods of July 2nd, 2022 to May 11, 2023 will be compiled and sent to agency point of contacts. That's why it's important to have the up-to-date information because money is coming to you. These are federal money. We thank Mr. Jerry Delbar, Director of District 18 for NYSARA, for his continued technical assistance on the matter. And lastly, HMAs of Narcan are available to agencies. Please email myself to arrange pickup. Volunteer agencies may also reach out to Jim Downey, as their district court director for Narcan as well. And a report.
And then the program agency update, right?
We're nearing the end of our fiscal year, and we put in our vouchers up to the third quarter. We're getting ready to put in vouchers for our fourth quarter, which ends. Our year runs from July 1st to June 30th. So we'll be putting in requests for payment this last quarter. They're a little late with paying us. Actually, they could be a lot late for paying some things, but it's getting better. They have new staff, and we've been communicating with them, especially this whole week. I can't say. Just went right out of my head. You know what I was thinking?
No idea. Not South. I'm sorry.
Feel like we're in a CAT scan.
Yeah, this is like. Oh, we are working with the fire department right now because regional council, according to Article 30, regional council decides who are program agencies and what our deliverables are. So we are going to be meeting with the fire department to discuss their memorandum of understanding and identify the new deliverables, since we no longer have paper PCRs in New York City, and we want to work with the fire. Well, we're partners. We're working together. We just want to make sure you're not trying to do the same things that we're doing, and that you do serve the greater EMS system. So I'm going to be reaching out to Dr. Seda or to Frank to set up meetings so that we can get this done. It should have been done a while ago, but we just missing days with each other. So hopefully that will be done for the next 2 weeks, because it really should have been done for the July 1st. That's the beginning of our contracts, but we are trying, and we have been meeting. And that's all I have.
Thank you. All right, the next item is ambulance committee report, and that would be me. We are moving along with the security sticker tag. We got funding approved, so Jerry, you're gonna go ahead and move along with that, right? And then a letter was drafted. Everyone at the ambulance committee voted on it. They approved. They're going to send some final information over to Jerry, and then we're going to send it over to the governor's office regarding congestion pricing. NTA, sorry, regarding the congestion pricing. And the report.
We have to vote on that.
Let me clarify the motion. The motion was that the committee is there. There's a draft here, and I'll send it out to everyone, but the committee is going to be making revisions to the existing letter. The letter is going out to everybody here on council so that everybody has a chance for input. Last day for input is Friday, June 30th. At that point, the letter will be finalized, and we're asking, they're recommending, ambulance committee at the form of a seconded motion is asking that this council approve sending this letter out, not just to the governor, but to whichever bodies are involved in the creation of this. It could be MTA, maybe even the mayor's office. We have to do a little more research as to who the letter is going to. That's your motion, seconded, so just requires a vote.
All right, all in favor? Anyone abstaining?
Thank you very much.
Next item is training education committee report.
Training and Ed did not meet this month. We're actually going to meet on Friday. Our agenda over the summer is primarily going to be preparing the next protocol update. Otherwise, we are going to start on a mission to move ahead with some de-escalation training. I'm going to be talking to other partners about that. And we're going to, there's been a lot of demand recently for instructor updates with all the new regional faculty in place. There have been requests all over the place coming in, so I'm going to try and just get that work together, since it hasn't really been a cohesive one. And now that we do have a good group to get a group of all the RFs together and set up some sort of schedule or at least some forum for them to discuss these things so that it's done in a coordinated fashion. And that is basically the report. In terms of the LMS, everything continues to be up and running. People are refreshing without a problem. Kevin Ward reports up regularly at CNC and REMAC. And as I said, we just encourage everybody to continue to host your events through the LMS so that it's easier for folks that are refreshing. And the report.
Next item on the agenda is the Regional Emergency Medical Advisory Committee report.
I can get some information on that.
Wait a minute.
Well, first, you want to do, I'm sorry, I thought you said state council. So I'm going to REMAC.
REMAC committee.
And I think
Yeah, REMAC did me, thank you.
Okay, REMAC committee. Quality Improvement Committee.
everyone wants to do it.
Sure. So QA has not met since the last REMSCO meeting. But earlier in lieu of a QA meeting on June 7th, we did hold a regional forum on various data integration projects that are being held throughout the city. Including the regional rollout of the First Watch dashboard for STEMI and stroke. So for those agencies that are 911 participants, you should be getting reached out from First Watch to start receiving your credentials and seeing that those that additional tab on your First Watch dashboard. We also spoke about the New York CARES project. And we had reps from CARES on the forum to start outlining some of the requirements for agency participation. The committee does fully support all agencies within the system to participate in CARES. We'll be sending out follow-up information to the region on how you can get signed up, what the requirements are, and what the lift is agency-wide. Then finally, we spoke about a project that's been in the works for quite some time, which is connecting EMS data into the New York City Health Information Exchange, known as HealthX, and ultimately getting that data connected to the State Health Exchange, and as well as automation of getting EMS data from the agencies into the hospitals. So we had presentations on all three of those subjects. Obviously, all three of those projects are rather large. We'll be doing follow-up data on all information on all of them. Yeah, we're all excited. So the next the next meeting of the QA committee will be on July 5th in the evening.
Thank you. Next item is the State EMS Council report.
Doug, do you want to?
The state one, or do you have?
The state.
I mean, I have some things.
Yeah, no, go ahead.
State council met May? No,
What month are we in?
Second week of May.
it's really bad. I can't remember anything anymore. They met at the beginning of May. And we discussed the governor's budget and what was actually approved. One of the things that, well, everything that we did not want in it, basically everything we didn't want is not in it. What managed to slide through was EMS task force, which may or may not affect New York. But one of the things that we have to do as a council and as representatives to state council is make sure that we are on committees. I've already asked, we put on a legislative committee and systems committee. There's also going to be a regulatory committee being formed to discuss how this state task force is going to be created and run. And you do not have to be a member of state council to join these meetings.
You don't have to be vetted either.
You don't have to be vetted. You could just go up there and talk and be involved. And just let them know that we are watching them.
What is this thing supposed to do? This regulatory committee?
Create the regulation for the EMS task force, the new pieces in Article 30.
all the pieces that came out in the governor's budget that were approved that require regulation or regulatory pieces
Yeah.
is going to come back to SEMSCO for review, discussion, and to develop those pieces that enact the regulation to carry out the functions that were.
Which is part 800.
Do we think there's anything scary?
Oh, yeah, there's a lot of scary stuff, especially if we don't participate in creating the regulation.
No, I understand, but I just wondered if there was anything specific.
Right now, the only thing I'm concerned about is the task force.
It's ill-defined, that's the problem. And that's the problem, these subcommittees, they'll define it further.
Yeah, I mean, the EMS task force, I mean, if it's funded and or it's an unfunded mandate, it only will have certain capabilities. There are other states that have EMS task forces,
Which work.
which we will know about.
Yeah.
They work well. It's just a matter of how we put ours together and what the marching funds are.
I just want to add, Maria, I apologize, but we really need to be present. This should be a wake-up call to us, and even some of the other discussions, there were comments about removing greater than 1 million that was made by certain, but the point is, we need to be involved. We got to show concern. Group from New York City, it's not like an agency specific, but we really need to, the next meeting's in September, and we have to make sure that we're all involved in subcommittee. So what I respectfully suggest is put that out, who wants to be involved in subcommittees, and let's get these names up now so they, can't make any excuses of, oh, we didn't get the emails or notification ahead of time. So
Well, it did say, go ahead, I'm sorry.
I'm sorry, I was just asking if you have a listing of the dates for upcoming meetings.
Number
it's September, December,
12
we can
and
get there.
13.
There will be meetings over the summertime. That's why I sent out to everybody. Boardable is an electronic site that the state is putting all the meetings on, all the documents. And we sent to the state, and your names are on it already, with your email addresses. So
I already got an invitation.
you did, okay.
So
Because I've asked them to give us some information to pass on to you how to use Boardable. Because just sending out this email doesn't help if you don't know how to use it. It's really pretty user friendly. Once you go on, you see all the committees. And then if you click on SEMSCO, then it'll come out with legislative, regulatory, and then each one of them will have documents. And then you have documents in different places. If you just play with it, you'll see everything. And whatever interests you, you should look at the documents, and you can post comments, or you can write to the chairperson. And what I ask is, if you are writing to chairpersons, copy us so that I can start keeping records of.
Do you know exactly what we've been given access to?
You've been given access to everything, to all the committees. You're supposed to. If you are blocked out of something, let me know. Because we sent up everybody from REMAC, medical standards, REMSCO, and our alternates. Because everybody needs.
Most of the stuff there's like.
It's flying a lot. There are a lot of blanks because it's still in the system, but it's being filled up. So use Boardable, and as I learn better how to use it, we'll write instructions and send it out to everyone. Okay, one thing I wanted to let you know, CMAC at SEMSCO, which I consider a victory, supported and approved the credentialing of EMS providers for our paramedics. Because the State Department of Health staff have been saying that what we have been doing for 40 years is not legal, it's not in article. Which is not true, because it's definitely in Article 30. I had sent up a letter a few months ago, which they had not distributed because they were so busy getting ready for EMS week or whatever. But at this last meeting, we pushed it again. Fortunately, it wasn't New York City that had to push it. Some of the docs in southern areas, southern parts of the state pushed it, and it was approved at CMAC and SEMSCO. I imagine that we're going to get some pushback from state staff who really don't want us to be able to do this. But it is what it is. Right now, it's being supported, and they're supposed to be putting together, which I also asked, and I think you did ask, on whatever committee writes that advisory. So participate, and if you have any questions, reach out to me. I will do my best to get you all the information you need to at least participate electronically in these meetings.
Yeah, that was gonna be my question. Are these meetings all gonna be in person or they're gonna be electronic? Obviously, it's better if you go there, but still.
I think for the most part, they're going to be electronic over the summer.
Yeah,
That's
it's just the ones, it's the quarterly before the, the day before the actual CMAX REMSCO, those are always in person and there's no electronic option usually for those.
No electronic.
But the meetings in between there are.
Anywhere can be remote, but the statutory meetings have to be in person.
Yeah, no, but none of the committees of STAC or of CMAC or SEMSCO are statutory. Only CMAC and SEMSCO are.
Most of the work occurs in, like, I'm on the quality metric one, and most of the work occurs between, and it's really just the quarterly one is more reporting out the work.
Sure.
Yeah, you have your workers, their committees in between, do all the work and then present.
And there's two committees with new names, Innovation and Research Committee and Legislation and Regulations Committee.
Yeah, those are very.
That could be important.
And that's the other part of part S that I think is really important. It's the sustainability and I can't remember the exact language, but it's creating parameters for measurement parameters for how your ambulance agency is functioning and the metrics. I think that every agency should be really looking at that language and participate in whatever regulations come out of there, because that's going to directly affect how you function. And that, they're saying that there might even, I think the language even included the ability to be fined.
Yeah, the way it
So-
sounds, at least from the quality, like the discussion we're having on the quality metrics, and we're actually meeting tomorrow for the first time since the SEMSCO, but it's not like we're not going to set like a quality metric, like you need to get a cardiac arrest save rate of 80%. It's going to be like your agency needs to select and measure X number of quality metrics from the recommended list by the state, or it's more, I would actually compare more to like standards you would see like an accreditation standard.
That sounds like CAS stuff.
Exactly. I think that's kind of the language I would borrow if I was writing stuff, would be taking it from accreditation standard. Like you need to pick a measure and be performing a PI project. Right,
They are
it's-
good things, but you have to remember, I know that part of the language also says that your agency may be taken away.
That's under the operational metrics.
Yeah.
Different than that piece.
Well, even I think that the way that they're more standards than metrics,
Yeah.
than
Yeah, it was outlined in it, but again, as Marie pointed out, all of that came out in the budget, that requires regulations to be back.
right. But that was actually the direction we got from the state, was not to set, like, even from Ryan, was not, we're not like setting you must have a 75% rate on this measure. It's more that you are actually, right now the standard is you have to have a QA committee and have a QA program. It does, and that's about it. It doesn't say what you have to do
I
it.
mean, that's been in the law for a while.
Right, but there's
We really
nothing-
haven't been doing it.
You can have a QA committee, it doesn't actually do anything. In the way the current regulations are written.
Well, I'm very happy that you're on it. and I
Yeah,
hope
there's
that
actually
people-
3 of us on quality metrics.
Who else is on it?
Sean and Dr. Redletter.
Okay, I knew Dr. Redland was here.
And we're gonna get Pamela on that as well. She does our QA/QI.
That's
I'll
good.
make sure she gets-
And that's what we need, so I'm spreading the word here, get people on it, at least so we understand what's being done. That's all I have for state EMS.
All right, and then unfinished business,
It's all on.
it's all unfinished.
I
All right.
know.
Hearing none. We do have new business, we have nominations, right? We have an election.
Yeah, these are easy. These are reappointments. They're not, there's one at-large seat to be reappointed and two organizational seats to be reappointed. So let me just read this message to the nominating committee. Nominating committee of the Regional Events Council, New York City, Inc., met via email. Nominating committee members were Jack Kisk, Lorraine Giordano, Rafael Capolanos, Martina Barcarella, Robert Krupe, and Dennis Laurie. The primary function of the nominating committee, which is comprised of 3 members of the board of directors and 3 members of the regional council, is to review nominees for appropriate provider representation and balance, as well as the expertise of the individuals in the areas most appropriate for a particular period of time the council will re-elect. The following seats are recommended for reappointment beginning July 1st, 2023. The organizational seats are for the New York State Volunteer Ambulance and Rescue Association, District 4, primary member Travis Kessel, alternate James Downey. District 18, primary member Gerald Gelbart, alternate David Menkatansky. At-large seat, Nancy Benedetto. The member's term is for 4 years, ending June 30th, 2027, like the prison said. And we're presenting the slate for a vote now. I don't know if I'm allowed to say this, we usually have you, did you here, but if there are no objections, the secretary of the council can cast her vote for. Unless. there are any
So moved.
objections.
Let's do that.
Question, are they all New York City residents?
Yes, the primary is all New York City residents. David is, you are, Travis is, Gerald, and Nancy is, yes.
Rock and roll.
Good?
Right.
All right, show of hands or? All right, show of hands. Would you like for me to entertain you for the next 4 years?
Nancy's recusing herself.
For
Because
some vote, for some.
show of hands to approve. Okay, show of hands to not approve, oppose. You can see I'm having trouble with words tonight.
You guys get me for 4 more years.
And,
Sorry.
abstention.
I'm sorry. Guys,
Yeah, but
sorry.
Jerry comes along with that, so I don't know.
What's that?
But Jerry comes along with that, so I don't know. I think that's just.
Scary.
And she drove.
All right, so, any new
Congratulations.
business? Thank you. Any new business? Hearing none, guys.
Adjourn.
Before you leave, sign the attendance.
Good
Have
idea.
a great summer. Can all those meetings be like this?
I know.